Мама, можно потише?
Good morning, good afternoon, good evening, everyone. My name is Antonio Harden. I'm a child psychiatrist here at Stanford. I would like to welcome everyone for today's webinar that will be focused on supporting and understanding children with autism who have experienced trauma by Dr. Molly Cevasco. Before I introduce Dr. Molly Cevasco, I just want to mention that we've been doing these webinars for about 2 months now. And if you go to our webpage, and we will post the webpage in the chat, people can listen and watch the previous presentation. In the next few weeks, we have a few webinars that are scheduled. On June 8th, we have Dr. Micah Mazurek, who will be talking about understanding and improving sleep in children with autism. And on June 15th, we have Dr. Linda Lotspeech, who will be talking on supporting parents with kids with autism. So today, Dr. Molly Cevasco will be talking about supporting and understanding children with autism who have experienced trauma. And she's a psychologist, licensed psychologist who is practicing in the Seattle region. Dr. Cevasco earned her doctorate from the University of Washington School Psychology program. And she earned her PhD also from the University of Washington. And she is a board certified behavioral analyst. And she also worked in California. I was reading yesterday your CV or your bio. I noticed that you worked in Los Angeles and also at the UC Davis. So you have some California connections. She is currently has a practice that focuses on providing comprehensive evaluations for a variety of concerns, including learning disabilities, attention executive functioning, autism, anxiety, among many others. She has a lot of experience in dialectical behavioral therapy program and worked with kids with autism for many years. Before we allow Dr. Cevasco to start, I know that Daria and Dana will have to introduce people in Russian and in Ukrainian. They will have an introduction for us. Go ahead, Dana.
Добрый вечер, добрый день, дамы и господа. Это наш 7-й вебинар, посвящен проблеме аутизма и травме. И с нами Молли Cevasco, клинический психолог, BCBA, со штата Вашингтон. Я очень рада, что она представляет наш штат. И, как всегда, наш любимый и глубоко уважаемый доктор Антонио Хардан. Дамы и господа, пожалуйста, выберите язык. Я вижу, что люди подходят. Мы через некоторое время скинем презентации, которая будет сейчас на английском, на украинском и на русском языке в чат. Хорошо? Спасибо большое. Даш, ты.
Daria's turn, or should we go ahead and start?
Daria is here, sorry. Добрый день всем. Пожалуйста, вибирайте тот язик, который вам би хотілося вибрати. Будь ласка, оберіть той язик, ту мову, яку вам би хотілося обрати, яка буде бажаною. Через панельку, там є планетка, ви можете обирати ту мову, яка вам буде зручна. І, будь ласка, чекаємо на ваші питання через Q&A section. Дякую. Thank you.
Very good. Thank you. Before we start, just to remind the audience that if you have any questions, please put them in the Q&A tab, and anything in the chat we might not notice. So any questions for us, please remember to put them in the Q&A tab. Thanks, and without further ado, Dr. Cevasco.
Hi, good morning, good afternoon, good evening, whatever time it may be for you. I hope that if you're ending your day, it's been an easy one, and if you're starting your day, it's looking like it's going to be an easy one. I'm going to go ahead and start sharing my slides, and then we can get started on talking through a few things. Thanks, Dr. Harden, also for that really lovely introduction. And many thanks to Donna and Daria and Dimitro and Alexei for your interpretation support. Please let me know if there's anything I can do to make things easier on your end. Like you already know, my name is Dr. Molly Cevasco, and I'm a clinical psychologist. So that means that I spend most of my time working with children and adolescents. I spend time doing assessments for things like autism and also doing a lot of therapy work. I work primarily at Seattle Children's Hospital, and my areas of specialty are dialectical behavior therapy, which is really specialized treatment for people who struggle with suicidality, and trauma work. I'm especially interested in working with children and teens with autism who have trauma exposure because in my experience that service has been incredibly difficult to find for families. And we know that children with autism and their families are just as deserving of support and intervention as any other child is. Dr. Harden is right. I have worked in California. I'm also born and raised in California. I speak Spanish and English, which is unfortunately not going to help me today. But a lot of my work has been working with children and their families who've had to come to the United States without documentation, and the real challenges they've experienced, not only in the danger of coming here, the physical act of crossing a border, but also the discrimination and isolation that they often experience once they arrive here. So I won't say that I know what it's like to be moving around or maybe feel like you're not sure where home is right now, but I will say that this is not the first time that I've talked about this or thought about this with families. And I'm hopeful that what we talk about today is helpful to you. I'm going to stop every few slides to ask about questions because I don't know about anybody else, but I'm frequently too impatient to wait till the end of a presentation to ask my questions. So please do let me know what you're curious about. There are no bad questions. And I promise if you're thinking about it, someone else is thinking about it too. As mentioned, I live here in Seattle, Washington, which is all the way up here in this top left corner. This is not Washington, D.C. We're about as far away from Washington, D.C. as you can get and still be in the United States. You may have heard that it rains here a lot, and that is very true. I just kind of like to show people where I'm at. I just want to give a couple gentle reminders for you as participants that when we talk about things like trauma, people have all different kinds of reactions, and there is no one right reaction. For many folks, you may have gotten the message, or you may be telling yourself that you're supposed to be stronger now than you've ever been in your life before. You may feel like taking care of yourself is a luxury that you're not supposed to do right now. And I just want to remind you that if we want to take care of the people around us, we have to take care of ourselves first. And that means that you sometimes need to be gentle with yourself. That's not a sign of weakness. that's a sign that you are invested in yourself and the people around you. Because if you can't keep going, it's awfully hard to help the other people around you keep going. Sometimes I think people talk about self-care as really big acts, and sometimes taking care of yourself is something really small, like if it's safe to step outside and take a breath of fresh air. That's an act of caring for yourself. If you need to take a break during this presentation, I want you to know that that's really normal and okay. I'm glad that it's being recorded so that you don't have to be here to hear everything. You can always come back. And just a reminder to be as kind and gentle with yourself as you would be with other people. If you are noticing that you have really different expectations of how you are supposed to be doing compared to other people, it may be time to think about whether or not you're holding yourself to too high of a standard, and one that is pretty impossible to meet. I'd like to learn a little bit about you. Oh, and my animations haven't worked. That's okay. If you're able to, in the chat box, I'd just like to know if you could put a 1 if you're a parent of someone with autism or another caregiver. A 2 if you're a family member of someone with autism. A 3 if you're a teacher. A 4 if you're a therapist or another professional. And a 5 if you are someone with autism. This just kind of helps me get a feel for who's in the room, and how to tailor some of my discussion. Great, I see lots of folks chiming in. Okay. Great, I'm just taking a minute to look at this.
Yeah.
We've
Thank
got
you, Molly, because we were thinking of putting at the end or toward the end a survey that people will fill out, and they will indicate whether they are a parent, family member, therapist, teacher, professional, or someone else. So very good. That helps us get an idea in terms of who is in the audience.
Got it. Yeah, thank you. And I see that there are several people here who are parents and teachers and therapists, people who have autism. I just want to speak briefly about language around identifying as autistic. And I apologize if this is only something in English, but I do think it's worth talking about that. In English for years and years, we were told that the right terminology to use was a person with autism, so person first language. And we're hearing more and more from people with autism that they prefer to be identified as autistic, not a person with autism. And I will say that I am still kind of spending time trying to decide what is right or what's most appropriate. And if this isn't an issue in Ukrainian or Russian, please just disregard this. But I feel like it's important to bring up because I don't want to offend anybody, and hope that where I'm coming from makes sense. Okay, got it. I see lots of folks have spoken up. Great to hear that we've got a lot of therapists or other professionals in the audience. I hope that you also find some of the ideas here relevant today. We're going to talk a bit about therapy approaches too. So I hope that that is helpful to you. Great, thanks so much for sharing with me. Now that I know a little bit more about who's here in the audience, I just want to take a brief moment to thank you for what you do. I recognize that this is probably one of the most unique and worst times in many people's lives right now. And I won't pretend to understand what it's like to be living in your shoes. I will say that regardless of what your experience in the past few months or maybe few years has been, your roles as people with autism, as caretakers, as family members, as professionals, are incredibly important. We don't have enough people in the world who recognize how incredibly valuable the experiences of people with autism are. And so if you are someone who's out there bravely sharing your experience or trying to figure out how you want the world to know about you, I so appreciate everything you do to help people learn from you and with you. If you are a parent or caregiver, family member, thank you so much for all the work you've done before the world was deeply paying attention to what is happening in Ukraine, to care for your children or relatives. If you are someone who's newly caring for someone with autism because of changes in your family, whatever they may be, thank you for your curiosity and for being here and for asking questions. For those teachers and therapists and other professionals out there, I just want to remind you that you are part of a huge support network that makes people's lives better. And I can guarantee you, as somebody else working in the field of caregiving, I can probably guarantee that you're not getting as much support or acknowledgement as you need right now. And so I just want you to know that wherever you are, I deeply appreciate the work you do and the time you spend. And for everyone here, how much of your own personal life you're putting into creating a better life for yourself and the people around you. So just my thanks for what you do and who you are. I want to talk about our goals for today. My goals for you are that you walk away with some very real and practicable, able to be practiced skills around supporting children and adolescents with autism who may experience trauma, whether that's the trauma of what's going on in Ukraine and more broadly the world right now, or another kind of trauma like abuse or neglect. My goal is that you walk away with some specific things that you really want, that you can really use. I want you to learn about how common traumatic experiences are for people with autism. And my hope is that we can normalize how often people experience trauma in general. We'll talk about signs of trauma symptoms for people with autism and intellectual disabilities, because they are often very similar to typically developing children and adolescents, and there's some different things to look out for as well. We'll talk about some common misconceptions about trauma for people with autism and intellectual disabilities, because there are a lot of misconceptions out there about how people can be affected by trauma and how they can participate in treatment. We'll also talk about different treatment approaches and steps that caregivers or other providers can take to help address safety and keep children and adolescents safe, especially as we know that for people with autism, sometimes those social connections and social insight can be really tricky, meaning that it can be really tough to recognize what's a safe and unsafe situation or person. So we'll talk about that a little bit. I'd like to take a moment to, now that you know kind of my goals for the day and I know a little bit about who's here, I would just like to hear a little bit about, as you're looking at my goals, are there specific questions that you're hoping to have answered today? And we can take maybe 5 minutes to just check in about that, so I know to make sure that I'm touching on things as we go forward. So I'll give it a minute.
Molly, we have a questions. How do we help a child with anxiety in a situation when it's alerts, like airstrike alerts, And how can we help him with his adaptation? And the child is streaming a lot. It's one of the questions which is on the Ukrainian and Q&A. Ladies and gentlemen, if you have any questions right now, could you please type them? And if it's possible on English through Google Translate. I know I'm asking too much. And if no, we will be able to translate them shortly.
Great, thank you for that question. You know, the question of how do we help someone when something really scary is happening, that anxiety part is a really good one. And here's what makes my answer a little bit tricky, I think. As human beings, we have to learn what's safe and unsafe. Otherwise, we can't protect ourselves from true legitimate danger. And it's really tough to think about, how do you tell someone who we all know that the sound of a siren usually means that something unsafe might happen and that we have to protect ourselves. What we don't want to do is teach them that that's something to ignore, or that it's something not to be kind of anxious about. And so I don't want to say that we should tell kids, or adults for that matter, it's okay, don't worry about it, because that doesn't match with what we've told them all their lives or what they've experienced so far. So what I might say is, you know, the stimming part makes a lot of sense, because oftentimes it's a response to anxiety or real discomfort. If the stimming isn't negatively impacting someone, like if it's not a self-injurious behavior or aggressive towards someone else, I might consider letting that be okay for right now, and working on having a really predictable, or as predictable as possible, routine for when a siren comes on. So maybe if you hear a siren, you know that that's when we stand together, and maybe we sing a song that you really like, or we talk about something that's a favorite thing, like a favorite cartoon. And even if your child isn't able to talk, like to have a conversation, it can be helpful to kind of hear the same things over and over again. And so really, we're not changing the fact that that siren is really scary, but we're building in some predictability about what happens right afterwards. And that can be a really helpful part to start stabilizing anxiety levels and decreasing distress. I'm not sure if that quite gets at what you're asking. Hopefully it does.
It's another question in the chat that it's on in English. There was some confusion. People didn't know that they have to ask questions in Q&A. I'm gonna say it. Please, on the bottom, you see Q&A. Q&A. Ask question there. I'm sorry.
I'll take about one more minute here, and then we can keep going, because I'm sure that there's going to be other things we talk about that you'll have questions about. I see that someone asked in the Q&A, what should we do with a traumatic autistic child? My hope is that today in my presentation, we talk about some various different skills and strategies you can use to support a child with autism who's demonstrating trauma symptoms. So I'm going to hold off on answering that question and see as we move forward if I can answer that. And please bring it up again if it feels like you're not getting your question specifically answered. I'm going to go ahead and keep going, and I'll pause again in a few slides to ask about questions. let's talk a little bit about how we define trauma, and sometimes how hard it is to define trauma. So the National Child Traumatic Stress Network says a traumatic event is a frightening, dangerous, or violent event that poses a threat to a child's life or bodily integrity. Witnessing a traumatic event that threatens life or physical security of a loved one can also be traumatic. So this definition really speaks to that threat to life and safety that we so often think about as being traumatic. And that's absolutely true. And maybe what many of your children are experiencing now, or what you yourself are experiencing. I also just want to briefly talk about this idea that there's kind of this whole other kind of trauma that we don't talk about a lot, and that's this idea of traumatic invalidation, which comes from dialectical behavior therapy. And it's the idea of kind of the persistent trauma of not getting your needs met. And I don't mean in terms of neglect. I mean the world not understanding you or not giving you what you need. And I find that this is so true for so many people with autism, that they find that the world is not hospitable to them, or that the world doesn't understand them or criticizes them in ways that are unhelpful or don't make sense. So for example, I used to work in schools a lot as a teacher, and then in some other roles too. And I would often find that teachers would say, this kid doesn't pay attention. He never makes eye contact with me. It's so disrespectful. And for most people with autism, making eye contact is really quite uncomfortable. And I think this is just a perfect example of traumatic invalidation, right? If you're at school and you're listening and you're doing your best to participate and follow along and be involved, and you don't make eye contact, how devastating is it when the world tells you you're not doing enough or you're not showing up the right way? And this is so true, I think, for lots of people with autism, and also for their families. I know that often I hear parents say how isolating it can be to have a child with autism, because other people, parents or professionals, want to give you advice or tell you what you're doing wrong. And it's just not that easy. And oftentimes what we do to support people with autism gains criticism from other people who don't know what they're looking at. And that your role as a caregiver, whether that's a therapist or a parent or a teacher, is so often to recognize that the world around you may be quite invalidating of your experience, and you're still doing the right thing. The other part about trauma that I want to mention is that trauma is subjective. I've worked on a couple of studies of children with who've been placed in foster care, and nobody goes to foster care because everything was going well in their lives and people were taking really good care of them. And so by definition, something pretty disruptive has happened. And what's really interesting in those studies is there's really good evidence to show that although many children experience potentially traumatic things like abuse and neglect, not all people develop post-traumatic stress disorder or significant trauma symptoms. Human beings are far more resilient than we give ourselves credit for. And while everyone, I think, could benefit from supportive, validating environments, not everyone will need trauma therapy. And I just want to put that out there, because I think, especially in the mental health field and maybe in other fields, we have a tendency to look at people who've experienced something traumatic and say, well, they must have PTSD. They must really be struggling, and we got to get them into trauma therapy right now. And we actually have some really good evidence that that's not always what's necessary, and that it's okay to see people as resilient and thriving in the face of trauma. And they can have some areas of struggle at the same time. Both can be true at the same time. In the United States, there was a really interesting study done, oh gosh, like 25 years ago now, where, we used to kind of think of trauma as something that happened to other people in other communities, and certainly not here at home in our house. And this really interesting study was done, which asked folks when they would come in for like a doctor's visit, asked them to rate how many adverse childhood experiences they'd had before the age of 18. And in this study, adverse childhood experiences really talked about physical, emotional, or sexual abuse, physical or emotional neglect, so truly not getting your needs met, being exposed to household dysfunction, like caregiver mental illness, domestic violence, divorce, a relative who was incarcerated, substance use disorders, just a wide variety. And we certainly know that exposure to war or forced relocation is absolutely a kind of adverse experience as well. And what was really interesting about this study was how many people said that they had experienced at least one significant adverse childhood experience. So in this graph, I hope you can see that about a third of people said, no, I haven't had any of those experiences, but a quarter said that they had had one. And the vast majority of people, so like more than 60% of people said at least one adverse childhood experience had been part of their life. Of course, these are American statistics, and I want to be cautious about generalizing them to any other country or culture. But I think the real message here is experiencing something traumatic is not nearly as uncommon as we thought it was. And I tell you that because I want to normalize that if you've had something traumatic happen to you, if you've had at least one of these adverse experiences, your brain may be telling you, I'm different, nobody could understand me, I'm dirty, this is wrong, this is my fault. And I really want you to hear that actually you're in the majority if you've experienced anything like this. And this is so important for us as we think about how to treat people with trauma or adverse experiences, because we have to recognize how common this is. And if you're walking around with heartache or thinking you're alone, I want to guarantee you, you are not alone in that. And the same goes for your children. If they've experienced or are experiencing traumatic things, whether we're being very specific and talking about the current war, or we're talking about other kinds of trauma experiences, they're in the majority too. This means this isn't something you've done wrong. It's not something they've done wrong. This is part of most people's lives. I will also add that, the ACEs study was not specific to people with autism. And one of the things that I hear the most about from my patients with autism and their families is how often significant bullying or exclusion is part of their story, and how traumatic that can be. So it's a myth that people with autism don't want social connections, don't want relationships. We know that folks with autism have told us that's simply not true. And so being isolated or excluded at school or in other environments is also an adverse experience. And it can have just as important consequences as some of the bigger kinds of traumas that we tend to think more about. I know that also in the United States, and I apologize if this is not true in Ukraine or other countries, but in the United States, one of the really traumatic things that many of my patients with autism tell me is how often they are restrained or secluded in school or other caregiving environments for behavior that is often not deserving of restraint and seclusion, and how deeply traumatic that can be. I just want to acknowledge that because, the ACEs study wasn't talking about those things right off the bat because it wasn't specifically designed around children with autism, but I think it's really important to talk about. I want to do one more slide and then I'll pause for questions. I want to talk about the risk and protective factors for trauma-related symptoms. You've heard me say that not everyone who experiences a traumatic event develops post-traumatic stress symptoms. There are some things that we know tend to be more likely to contribute to post-traumatic stress. And I want to be clear that these are not risk factors for being a victim of trauma. These are risk factors for experiencing post-traumatic symptoms. So, one of the most important ones is we know that interpersonal trauma is often much more impactful on people than other kinds of trauma. So, for example, being physically abused by a caregiver is more likely to increase post-traumatic stress symptoms than being in a car accident one time. There's a difference there, and it's the interpersonal factor that really makes a difference because we are social animals by nature, and we need the people around us to take care of us. We know, as previously mentioned in my last slide, that exposure to chronic adversity in childhood, which can look like those ACEs, or we can talk about significant poverty. I would certainly say being a refugee or having to emigrate when that wasn't what you and your family wanted to do, being exposed to war are certainly examples of pretty chronic adversity in childhood. So while I would say that we could talk about the acute impacts of trauma right now on you and your children or the children you work with, we also have to know that down the road, these experiences may make them more vulnerable to trauma symptoms. And so they're going to need kind of long-term thoughtfulness about how they're doing and what they need. Kind of similarly, but polyvictimization is this idea that people can be victimized in more than one way and on more than one occasion. So, I think about some of my patients who are sexually assaulted and then go on to be in a different relationship where domestic violence is a factor. This is kind of an example of polyvictimization, and it increases the likelihood of post-traumatic stress symptoms. One of the really big factors we know that impacts trauma symptoms is thought suppression post-trauma. So thought suppression is the idea that we understandably, when we have scary or upsetting images or thoughts about a trauma in our minds, our natural tendency is to try and make them go away, right? We shove them down, we ignore them, maybe we cover them up with maybe unhelpful or unsafe behaviors like drinking or substance use. Maybe we try and ignore them by I know lots of folks that I work with have really big trauma reminders going off in their head, and they get into really big arguments because the intensity of an argument matches the intensity of that trauma reminder and kind of blocks it out for a little bit. And we know that trying to suppress those traumatic thoughts really increases the likelihood of trauma-related symptoms. And I think about this as like, if you've ever had, for example, like a beach ball, and you tried to hold it under the water, you could try your very best to hold it under the water, and eventually it's going to pop up somewhere else. And the same is true for trauma. If we try and ignore it and not think about it, it pops up in other places in our lives. And so really actually being able to talk about it is a hugely important step in decreasing trauma symptoms. We also know that unhelpful or inaccurate beliefs after a trauma are very predictive of trauma symptoms. So these are beliefs that don't quite fit the facts of what happened, although often we don't know that when we're talking about it. I can give you a couple of examples. So I have worked with patients who experienced extreme physical violence towards them, and told me, well, don't ever go to that city because everyone there will try and kill you. And knowing that they weren't living in a city where there was active bombing or true aggression in that way, helps me know that that's maybe an unhelpful or inaccurate belief. It's not true that everyone in San Francisco is trying to kill you, right? Or certainly I've worked with kids, especially kids with autism, who have told me, you know, if I didn't stim so much, maybe my parents wouldn't fight so much. Maybe they wouldn't hit each other. It's probably my fault that they do that. And sometimes we are fortunate enough that children can tell us what they're thinking. And for many of you, you may have or care for children who don't have the ability to tell us exactly what they're thinking. And so I will still say that I think it's very helpful, even if your child can't participate in a conversation with you and tell you these things, to say some of these things out loud, right? Like, the reason we are leaving this city is, it's not because of you, it's not because of anything you did. This is a decision we're making to stay safe. Because even if kids can't say it out loud, they may be having some part of that thought. And you being really honest and straightforward can really help decrease the prevalence of those thoughts. One of the last risk factors that I want to talk about is limited social support and withdrawal. And my hope for you is that you are part of a social network that's able to help you and help you feel like you have a place to go and be heard. And I know that that may truly not be how it is right now. And that, especially for people with autism, often social support is limited to begin with, regardless of whether there's a war going on. And that this may be part of your reality. And so I'm not telling you that you should, it's your fault if you don't have a lot of people around you who can support you. But I am telling you that this may be part of what makes things riskier for you and your children to develop some of these post-traumatic symptoms. So be thinking about that as you're moving forward, and thinking about, are there any connections you can make? And if not, being gentle with yourself about that too. I want to pause there because I see that there's some things in the chat and some Q&As that I want to be able to answer. And I unfortunately can't read. Okay, let's see.
Hi, Molly.
Yeah,
We
please.
have We had a first question, what we should do with traumatic child. We already answered this, so I'm like removing it. Second question, if a close family member might have psychiatric problem and doesn't understand it, cause scandals and cause anxiety in a teenager 11 years old with autism, we have to move out to a different place, so we're a bit lost our feelings of home. Member of the family causes trauma. How did you treat traumatized child? His father in a different country and doesn't communicate either. The teenager has only one family member who cares about, no friends, isolation. Too big to be a cute kid.
Yeah, that's, this is such a good point about teenagers. Sometimes they get way less patience from the world because they're not a cute, adorable 6-year-old anymore, right? And unfortunately, the reality is that so many of us have a family member with mental health concerns that really impacts our own stability and well-being. And I would say that the reality is if your child or the person you're working with has one family member who cares about them, that one family member may be the anchor right now in their stability. And that one family member may have to do a lot of heavy lifting right now to be able to care for that teen. And it's really important. When family members have mental health concerns, and when parents are in a different country or aren't available anymore, it is often just devastating to children, and especially for people with autism, where stability is so deeply, deeply important. And I would say that right now, that one family member is going to be key in establishing some really important and loving communication about how important that child is to them, that teenager is to them, and also that that one family member may also need to be thinking about their own forms of support so that they can continue to be present for that teenager with autism. I will also say that for teenagers and children with autism, emotion identification can be really tough. So knowing how you feel and being able to name it. And so if you're not already doing this, one important thing to think about is maybe that you work with them on naming when they're anxious. So that might look like, boy, you look really worried. I can tell because your eyes are scrunched up, or I noticed that you're rocking a lot more than usual, or I noticed that you're asking the same question over and over again. Are you really worried? And what are you really worried about? If that child has verbal skills. If they don't yet, it may just be naming it and doing some really nice self-soothing with them, teaching them that they can help themselves calm down with things like deep breaths, listening to favorite music, dancing, drawing, anything that kind of helps them get some of that anxiety out. And it's also really okay for you as a family member to say, I feel really sad about this too. I wish we had more people to talk to in our family. And that's not your fault, and it's not my fault. And the isolation is real for sure. And I don't know if it's increased isolation because you've had to move. I know you mentioned that, or because it's always been feeling really isolated. But I would say that certainly that isolation is really understandable, and that you may want to think about how can you recreate some of that feeling of home. Can you talk about how home used to smell? Can you talk about things that you used to see at home, or memories of what was outside your front door? Anything that can kind of bring back that feeling about home in some really sensory ways, because we know that people with autism tend to have stronger sensory seeking and sensory sensitivities. So that might be something I'm thinking about for you. I hope that's helpful.
Yeah, as I'm reading, the question is a little bit confusing. So I think if the close family member has psychiatric problems, I think it will be good if this individual is not in treatment, and if treatment is available, to try to seek that treatment and try to discuss with the therapist a little bit what are the difficulties that are being experienced. Easier said than done, but that's also something to keep in mind in case the individual, the close family member has psychiatric problems.
Yeah, of course, treatment is great, and I know it's just not always easily accessible. Dan, I see that you also wrote, what is a sign of PTSD in autism?
I've
And
translated questions. If you see questions with my name, it's usually I'm translating questions.
right, I figured. I think actually my next couple slides are going to talk about that. So hopefully that's helpful in a minute. Yeah. I don't see anything else in the Q&A, so I'm going to go ahead and keep going if that sounds okay. I'm just going to breeze through this one because there are some other things I'd like to spend more time on, but just to give you an idea that in the US, we know that about 1 in 6 children between the ages of 3 and 17 have a developmental disability. And at the same time, we know that the prevalence of substantiated abuse, so abuse that can be proven, is between 10 and 25 roughly percent, depending on the study. So we know that kids with developmental disabilities are at a higher risk of experiencing abuse or neglect or something traumatic, although that does not necessarily always translate to trauma symptoms. There's a really interesting study out of Israel that found that social incidents like being ostracized predict PTSD more strongly than violent incidents such as war, terror, or abuse. And so that's really important to think about in the midst of what you're experiencing. And that is also not to minimize that being exposed to war and terror is absolutely traumatic. But just to be thinking about kind of day-to-day life and how that may impact PTSD. We know that there's a couple things that contribute to heightened rates of abuse, and I'm bringing this up here because these are things for you to be aware of as you and your children or the children and teens that you work with are trying to get settled or thinking about long-term impacts of trauma and what may make you more vulnerable right now too. So we know that socioeconomic stress contributes to heightened rates of abuse, right? If you can't work because you have to take care of your child, that can be incredibly stressful and lead to shorter tempers or increased frustration. For people with autism, we know that communication and social delays are really a huge part of this too. That if you can't tell people what's happening to you, it's awfully hard for people to help you. And this is absolutely true in the midst of war, right? That we may be having our own experiences as adults, or you may be, and you may not know what a child that you're working with or that you care for is experiencing because they may not be able to tell you. And they may not be able to go out, as the person who asked that question before, they may be really isolated and may not be able to go out and talk to other kids and talk through what's going on. We know that challenging behavior really increases the likelihood of abuse. As I mentioned before, restraint and seclusion are a big problem in this population. We know that parental grief and their own intense emotions can really impact a child's likelihood of being abused, but also probably their likelihood of developing PTSD. If you as a parent or caregiver are struggling to manage your own emotions, one of the best things you can do for your child is to care for yourself first. If you are having really intense emotions around them, you are likely not improving their well-being right now. You got to take care of yourself first. We also know that just involvement in multiple systems like school, medical, mental health, and being dependent on other people increases the likelihood of abuse because there are more people they're interacting with. Let's talk about core trauma symptoms and specifically for people with autism, how this looks. So we know that one of the core symptoms of trauma is intrusion. That means memories that you don't want to have that keep coming up, like that beach ball that I mentioned before, nightmares, reenactment in play, so reenacting what you saw or felt, distress about reminders of trauma, physical reactions to trauma, like shaking, trembling, sweating, and dissociation, so kind of being checked out and not really being present. And I will say that for people with autism, these symptoms can look a lot like really big tantrums or big behaviors, because if you're having really unwanted memories, you may not have a way to tell people that, or you may not know if it's okay to say it, especially if communication is delayed. And so noticing big changes in behavior can be a sign of intrusion, especially for people with autism. So this can look like, I know someone mentioned increased stimming. That can be a real sign. And certainly nightmares too. So if you notice that your child's sleep is significantly disrupted, and it didn't used to be, or it used to be disrupted in a different way, that may be a sign that they're having nightmares. One of the best things we can do about nightmares, certainly aside from getting them into trauma therapy, or maybe in addition to getting them into trauma therapy if it's available, is to talk kids through changing the content of their nightmare. So if possible for your child to communicate, whether verbally or with drawings, about what happens in a nightmare before they go to bed, talking them through. I remember that in your nightmare, you said people broke into the house and hurt me. You can say, we're going to change the story and say that people came to the house and the door was really strong and they couldn't come in and we were safe. It doesn't matter if that is true in your day-to-day life. What you're working on is changing the quality of their dream to give them better sleep, because we know that sleep is really so impactful for mental health. Let's also talk about avoidance. So a big sign of trauma is avoiding people or situations, places, reminders, activities that have to do with what happened. And so that may mean that all of a sudden your child doesn't want to talk to or doesn't want to be around people that they used to like to be around, purely because they were in the same place when something really scary happened. They may change their eating habits. I think especially for people with autism, I see a lot of avoidance around sensory reminders. So specific noises, specific smells, tastes, the feel of different fabrics or items. And so I would be really paying attention to if it seems like you or your child or teen is suddenly having very big reactions to certain people, certain sensory things, that may be really an example of avoidance. And again, it's great if your child can tell you those things out loud. And if they can't, you may have to be really sensitive to recognizing what might be a reminder. I sometimes ask parents of children with autism to keep a journal of when your child has a big reaction, to write down exactly where you were, what was going on, what was around them, who was there, what time of day was it, to see if you can start finding a pattern of what they might be avoiding or having a big reaction to. We also talk about changes in thoughts and beliefs, and this is what I was talking about earlier. So unhelpful thoughts or beliefs like, it's my fault that my family had to leave home, or I did something that made my dad go away, or one that I hear often from kids whose parents have been killed, for example, is if I had only said goodbye one more time, this wouldn't have happened, right? And it makes perfect sense that this is what our brain does. Our brain wants to make sense of something that just cannot and will not make sense. And so being aware of if your child is telling you stories or has beliefs that just don't quite make sense, it's okay to say, I have a question about that, because I'm not sure how to make that make sense. I'm thinking about a child with autism that I worked with whose mother was very brutally murdered in front of him. And he told me, well, it was my fault. I must have been the bad guy. And it was not as clear as that. This took months and months because his verbal skills were not super strong yet. But he said, I must have been the bad guy because the police were there, and the police only come for the bad guys. And he said, and they put me in the police car. And so that's how I know that I was the bad guy and it's my fault. And what we ended up talking about, and mostly through play, again, because his verbal skills weren't real strong yet, was, yeah, but how tall are you? We talked about, and and we measured him next to me, and he was much smaller than me, of course. And he said, I said, if you aren't as tall as me, how can you get me to do what you want? And we actually practiced, like, can you get me to do things? Like, can you get me to give you unlimited snacks today? And inevitably, most of the time, he couldn't get me to do what he wanted. And we talked about, right, because I'm an adult and you're a small kid, and you can't get adults to change their behavior. So you couldn't get this person that murdered your mom to change his behavior. And your belief about being the bad guy because the police were there, I asked him, will the police make the bad guys sit in the back of the police car? Where did you sit? And he said, well, I didn't even get in the police car. And that was really helpful for him to decide that meant that he wasn't the bad guy. It wasn't his fault. But it was really tough for him because for lots, he has autism. And so his thinking was pretty rigid about this. It was either true that he was a bad guy or it was false. There was no in between. And that's kind of different than many typically developing kids who may be comfortable in that gray area for a little while. So especially for parents and therapists out there, I would say, be thinking about really concrete ways to talk about whether those beliefs are true or false, and can you prove that they're true if a child is really hooked on them. We also talk about changes in behavior, so irritability, being more angry, hypervigilance, so looking for something to happen or being on guard all the time. This can also look like increases in self-injurious behavior in kids with autism, and sleep disturbance. I often see folks say that they think their child has ADHD or attention problems because they have a hard time concentrating. And I hear this a lot where people with autism, and that may be true, but it may also be that their brain is really running at like 1,000,000 miles an hour because they are trying to keep themselves safe with changes in their behavior. This can also look like just being really withdrawn. So not really engaging with people anymore. And that takes some time to change because your child may truly believe, and it may be true, that it's not safe to be outside and be with other people. And so it's okay to say it's normal that you want to be alone or you don't want to do anything. I can help decide what's safe and what's not safe for us to go do. So really reminding them that you are an adult and you can be trusted, and that you can help them decide what's safe and what's not safe. Which also means respecting when they're feeling really scared, that you may have to say, okay, I understand that it doesn't feel safe right now. Maybe we will try this again tomorrow with little steps. Talking about communication and trauma with autism, communication is such a core part of autism that it makes sense that communication really changes when something traumatic happens. So this can look like changes or decreases in verbal communication. So if your child was talking, they may stop talking. Their talking may be really different or less. If your child is not verbal yet, this may look like more moaning, groaning, big loud noises, big angry noises. Also increases in repetitive language. I have worked with lots of kids with trauma and autism who had varying levels of communication skills, but one thing I saw a lot was really repetitive language increasing. So like coming into my office and saying, Dr. Molly, I know you know what happened, over and over and over again, or some other kind of repetitive memory coming out over and over and over again, which is also part of telling and retelling. So you may find that your child is kind of telling and retelling, whether verbally or with their behavior, what happened over and over and over again. And I want to normalize for you that it's okay for you to put limits on that and say, you can tell me that for the next 10 minutes, and then we need to do something else. It's okay to put a limit on that. In terms of behavior, we also see big behavior changes, and one of the most frequent ones is increased aggression. So if you notice that your child is suddenly much more argumentative or much more physical than they have been, this can be a real sign of trauma for them, and acting it out, and including increases or changes in self-injurious behavior. So if you're noticing more self-injury. Hyperactivity can also really increase in children with autism and trauma. And in general, you're looking for behavior that's really different from what's typical for your child. So I'm not talking about in terms of their age, what do we expect, but developmentally for them, if their behavior looks really different. Another big sign is incontinence. So they used to be able to use the bathroom independently, and that's really changed, especially at night. Or general regression in behavior. So if your 8-year-old has typically acted like an 8-year-old, and now they're acting like a 3-year-old, they're not able to use the bathroom independently when they used to be able to. They're using baby talk when they talk to you. they're really clingy to you or to someone else. Those are examples of regression in behavior that we tend to see more often in people with autism. Just briefly about some thoughts and beliefs about that are often true for people with autism who've experienced something traumatic is just really increased hopelessness, which for people with autism may look like really not being as independent as they used to be. You may find that your child or teen wants you to make them a snack when they used to be able to get a snack themselves, wants you to tuck them in and stay with them all night when they used to go to bed mostly independently. And that can be kind of a sign of hopelessness, like, I don't know if I can take care of myself. I don't know if the world is safe for me to do this on my own. So be alert for some of those signs of needing you to do more for them, which is not necessarily a bad thing right now. That may be your way of showing them that you're a safe and trustworthy adult. And if you are safe and trustworthy, that they can also work with you on trying things that are really scary for them right now. Their beliefs about the world may change. Nobody is safe. No men are safe. No women are safe. People with brown hair can't be trusted, right? All different kinds of beliefs about the world can happen. And I know that often when kids say something like that, like, don't ever come to San Francisco because everyone here will try and kill you, our really immediate reaction is to want to say, that's not true. Why would you think that, right? Because in our minds, we think, I don't know why you would think that. Actually, it can be so helpful if you can ask them questions to learn about why they believe that. And questions can also be a great way to start to disprove some of those things. Like, gosh, well, I went to San Francisco and I had a really good time. What do you think was different for me? We know that challenging social interactions are often true for people with autism, regardless of trauma exposure or not, and it can get harder. So I know somebody said that their child is really isolated and withdrawn. That can be, that is certainly true for lots of kids, and that experiencing something traumatic can mean that all of your resources are going to just getting through the day. And something that can be a really big demand, like social interactions, for people with and without autism, can simply be so taxing that it's overwhelming and it doesn't go well. And then it becomes harder and harder to do. So it may be that social interactions that it used to be that your child would play with other kids for 2 hours, and maybe right now you can help them try it out for 10 minutes and then it's time to take a break. For people with autism, it can also be really tough to recognize safe and unsafe people and situations, because often the ability to recognize social cues is not as strong in people with autism, and we know that it generally worsens for most people who experience something traumatic, meaning that we may think, like I said, everyone is dangerous, or we may not, people with autism may not have the ability to recognize things that make one person safe that make someone else unsafe. So if you notice that your child is sort of willingly talking to people that you're not comfortable with, or walking up to strangers in stores and starting a conversation, that may be a sign that they're really having a hard time differentiating who's safe and unsafe. And you may really need to sit down with them and make a list of signs of safe people, signs of safe places, signs of unsafe people and unsafe places. I want to talk about myths about children with developmental disabilities and trauma. So one of the most common myths I hear is that kids with intellectual or developmental disabilities can't engage in treatment. I do enough of this work to know that that is not true. that therapy may look really different with these kids, and they can still do it and benefit from it. It's really us as mental health providers that need to be more flexible about the way we deliver treatment. Standard mental health is ineffective for children with intellectual or developmental disabilities. We know that that's just not true. And one of the things that happens with that myth is that people believe that behavior modification is the only option. So really changing someone's behavior without getting at the core causes for those behavior changes, like increased tantrums. So trying to decrease the tantrums without addressing the fact that they're having tantrums because they're terrified. A big myth I have heard is that youth with intellectual disabilities don't experience trauma, that somehow they're protected from it. And that's just simply not true. And I think you all know that better than most. Challenging behavior is always best explained by an intellectual disability. That's just not true. Challenging behavior can be a really important sign to us that something is wrong and that a child may be experiencing traumatic stress. Similar, but that children with intellectual or developmental disabilities are protected from trauma. They just don't remember. That is a really old belief, and it's not true. We know that all human beings can experience trauma and can be impacted by it. Last but not least, clinicians have to have extensive treatment experience working with people with intellectual or developmental disabilities. Therapists out there and teachers, I would tell you that your experience is enough to work with kids with autism and trauma, and that I would really encourage you to think about how can you modify some of your treatment. So instead of using lots of words, can you use visuals? Can you use pictures? Can you do sensory activities to help practice emotion regulation? Can you do deep breathing? And recognize that you will need to spend more time on relaxation skills than you might with a typically developing child, because this takes more practice for people with autism. Also for clinicians, emotion identification is really tough for people with autism. And so if your typical clients can tell you, I realize now that I was really scared when that happened, and that I keep being scared all the time. Folks with autism may not be able to tell you that because they may not be able to identify what that emotion is. So just keeping that in mind, that that you may not get to that kind of statement, and it's still really important to label emotions and practice them. Just a couple quick things. So core concepts in treatment and parents, this can be true for you too. We really want to normalize trauma experiences for people. We can talk about how many other kids may be experiencing something similar to them, how many other kids are having to move without wanting to move. What we don't want to do is let trauma make people believe that they are dirty, different, alone, ashamed, that this is really normal. Rebuilding safety is one of the core parts of addressing trauma exposure. So you as a parent or as another caregiver, the best thing you can do for your child right now is make things as predictable as possible, have routines, be where you say you're going to be as much as possible, because those are signs that they're in a safe relationship and a safe environment with you. And if it's unsafe, it's really hard to make any progress on trauma symptoms. I often say that if you are living in an unsafe environment or an unpredictable environment, it's like to treat trauma in that environment is like having a picnic in a hurricane. You just can't. And so your efforts at rebuilding their safety, however that may look, are really, really crucial. And relaxation. So if you and your child or your patients can work on relaxation skills every day. So like this is the time when we take deep breaths, we're going to do that for 10 minutes. Anything that can be a reliable part of their day to practice relaxing is very important. Put it in your schedule and make them know that it's always going to happen as much as possible. I saw someone ask about like, how should I talk about my trauma with them, or will it scare them more? I would say, yes, talking about trauma is really important. That if we talk about it about how we're doing, we can impact their functioning too. So it's okay to say, you know, I feel really scared too. I saw some scary things, and I'm not sure how I feel about it. I would not go into depth about what you saw unless they're talking about it and they saw something similar, because it may not be helpful to kind of add to their distress. But it's absolutely okay to say, yeah, I saw really scary things too. I saw that person too. I was really scared. Sometimes I'm still really scared. And even though I'm really scared, I'm still here for you, and we're okay together. That's a really safe way to talk about your own trauma. Recognizing their inaccurate beliefs. So it's okay to acknowledge that something may not be true, right? Or that their interpretation of it may not be true. First, I would acknowledge their emotions make sense. It makes sense that you'd be really scared if you thought that the reason we had to leave was because of you. And I want you to know that that's not true. It's absolutely okay to put limits on trauma talk. So we don't have to let trauma talk go on indefinitely. You can say, you know, for the next 10 minutes or however long feels safe for you as the adult, right? Because you are working through your own trauma. It's okay to say for the next 10 minutes, we can talk about that. And you can ask questions and I'll do my best to answer them. And then we're going to stop for the day. We can talk about it again tomorrow. Because we really want kids to learn that they can put limits on that thinking pattern. And if children aren't ready to talk yet, respect their boundaries on that. We know that in therapy, one of the worst things we can do for kids who've experienced something traumatic, especially grief and loss, is to force them to talk about it too soon. We know that that is not helpful in healing. I've got one more slide. Just some quick steps for you as caregivers, in addition to thinking about how to prevent abuse. So always teaching and respecting body rights. So I never tell kids they have to give me a hug or give anyone else a hug. They get to decide who they interact with and how. Helping develop adaptive independence, so using the bathroom independently especially. Practicing saying no, going to an adult and telling what happened as much as possible. Use accurate terminology. So this is not only true about body parts, using accurate terminology, but also about things that they may have seen. So if they're talking about guns, it's okay to use the word gun to help them put words to it that other people will be able to understand in the future and respond to appropriately. Reducing isolation as much as possible. I know that right now that may just really not be possible, and that's okay. But for your child to see that you're talking to people on the phone or WhatsApp, that you're doing okay, can be really helpful for their isolation too. Be as open with medical and mental health providers as you can. I know that it can be exhausting and invalidating to restate your story 1,000 times. I'm always okay with, sometimes parents will come in with a written letter of what has happened, and that's enough for me to know that it's not going to be helpful for me to ask a million more questions right now. And also just recognizing your own unhelpful thoughts or beliefs and how you may need some support changing them to be able to help support your child. Last but not least, I just want to tell you all that everything that you have done up to this point is enough. You've done amazing work. The fact that you are here is proof that you care deeply about your children or the children in your care. There is no magical thing you could have done to change the way things are. There is no magical thing you could have done to protect your children or the children in your care from the experiences they're having and the symptoms they're having. The best thing you can do right now is to continue to be reliable, be predictable with them, be open about how you're feeling in age appropriate ways, and continue to be there to listen as they try and figure this out. But I want you to hear that you have done exactly what you were supposed to do in an unreasonable and unfair situation. I know that there are some questions and I'm going to try and answer them for a couple minutes. I also just want to put my email up. I do have access to interpreters sometimes, but if you have questions and you want to reach out, I'm always happy to try and help. I know we just have, oh, sorry, go ahead.
No, thank you very much for this great lecture. I am sure that everyone felt it, that it's very helpful. I think what was great is that bringing it to kids on the spectrum with different level of abilities. I know we don't have much time. Probably have time for one question because it will be important to end on time. Meanwhile, Christelle will send a message to all the attendees to provide us feedback so we can tally this information and keep track of the feedback that we are getting. So, Donna, do you have any question that can be answered quickly? I have one here. Can you describe about sensory trauma? Or can you tell us more about sensory trauma?
Yeah, I think I understand that question. I would just say that, as we know, people with autism are they have more sensory sensitivities than typically developing people might. And that means when I think about trauma and people with autism, I think a lot more about addressing sensory experiences that are part of their trauma. So, for example, like I mentioned, what did it smell like when the really scary thing happened? What kind of things did you see? Like what shapes, what colors, what textures did you notice? Because I know that there's a strong likelihood, more for people with autism than typically developing folks, that their trauma reminders may come in the form of sensory sensitivities or sensory seeking behavior. So seeking those things out again to kind of reenact the trauma. So just being aware of how that can impact their functioning and their trauma experience is really important.
Very good. Thank you. One last question.
Okay, I have a question. It's a question about acute psychological trauma. Child after relocation experience acute psychological trauma and how parents has to behave and what's available resources if you know something, and so like how can I help child to be like engaged or at least tell me what's going on, because I was asking more questions trying to figure out what is the question.
Yeah, boy, that's a tricky one because it's kind of it depends on the situation, but I would say that if something really acute has happened, including relocation, I would expect that for someone with trauma, with autism, relocating in itself might be incredibly traumatic because it's a disruption to your routine. And I would say that I would expect that maybe those traumatic symptoms decrease as getting comfortable with relocation increases, which might take several months. So in those months, I would really practice relaxation every day. And I would practice making a visual schedule every day of what to expect, what you're going to be doing, to basically build in as much predictability as possible to day-to-day life, to help decrease the impact of that relocation. And obviously, if available, trauma therapy would be so helpful. And I know that that's so easy to say and really easy to do. But really, predictability, routine, relaxation would be the big things I'd be emphasizing right now.
Very good. Unfortunately, this is the end of the time for us today. I want to thank everyone for participating, for the great questions. I know there are many, many questions to go. And I want to finally thank our interpreter, Donna, Daria, and more importantly, Dr. Cevasco, for helping us out today. Hopefully there will be opportunities for us to come together again and to continue the discussion and try to answer the questions that have yet to be answered. Thank you, everyone. Have a good rest of the day.
Thank you so much.
Thank you.